Society tends to place the same standards on men as they do women when it comes to looks. However, when it comes to plastic surgery, it tends to be more of a women's club. So here today we have Dr. West and Dr. Gaon who are going to tell us if we have a misconception about men and plastic surgery. So gentlemen, coming from a plastic surgeon and a man's point of view, how challenging do you think it is for a man to pick up the phone and call about changing some of his looks?
That's an interesting question. Certainly it's not as easy as it is for a woman because it's expected that a woman is going to be walking into a plastic surgeon's office. For a man, however, the same issues exist. The man's looking at himself in the mirror as he's aging, seeing the bags under the eyes, the increase in wrinkles, the heavy, tired look, and he's getting those kinds of comments from other people at work or around him with his peers. And eventually, the phone call comes in, and we treat every male that comes in just as we do our women consultations, with the same questions, the same criteria for what is it about yourself that bothers you most that you want to change about yourself.
Now, what would you say is the most common thing that a man calls in for or comes in for?
That's interesting. I think that, I don't think there's any one thing that stands out with men. I mean, I think that we see a range of issues. We see 20-year-old men who come in with breast tissue that they're not happy with.
Wow,
we see
20-year-olds.
Yeah, you see 55-year-old men who come in, they don't like the way their eyes look. So we see a spectrum. I think that the same way, I don't think I could tell you there's one most common thing that women come in for. I think with men you see a range of issues, anything from the face to the chest to the rest of their body. So the same issues really that Dr. Gaon was saying, the same issues that touch women.
Mm-hmm. Now with men, they tend to have most men have male pattern baldness at some point, and they're interested in a facelift. What is something that you would suggest that they do, or how can you get around that?
So it's not a particular thing that's of a concern, except if the male pattern baldness is across the top of the head and we're considering a brow lift surgery or a forehead lift surgery. With a facelift, we hide the incisions such that it's in front of the ear, behind, and behind into the hairline, which most men still have, is that pattern from behind the hair. Whereas up top is where we start to thin out. So in those cases, if we do entertain a brow lift or a forehead lift, we simply use a different technique. We use the endoscopic approach, which uses much smaller incisions, very well hidden, very well placed to achieve the outcome.
Now, do you see that men get the same confidence change when they go in for a procedure when they come out?
Yeah, I think absolutely. I mean, whether it's the face or the body. So, take a 60-year-old man who comes in and says, I'm in the workforce. I'm concerned that over time, the company may start to look to bring in a more youthful appearing group of people for management, let's say. Okay. They're worried about holding on to their job, or a man who's lost his job who's trying to get back into the workforce. You do facial surgery, whether it's facelift, eyelid surgery. You take 10 years off the appearance of that person's face, and it drives up their confidence tremendously. So, they go back, whether they're currently employed and going back, and they think, well, I'm going to keep my job an extra 15 years for this, or somebody who was out of work gets that extra boost of confidence to go back on the interview trail, knowing that no one's going to judge them for the same way. They're not going to look at their jowls and say, well, I'm not sure this person's like this age, the right candidate.
Yeah, that is very interesting, because you're saying that men would tend to go in for a financial reason, like keeping their job or getting their job, where women might come in for a relationship reason, like getting a man or keeping their man?
I think we see both. I mean, I think you
see a little bit of both.
You see men who are trying to get back into the dating scene after divorce who come in for the same reasons. I'm about to get back out there and I want to look my best. So I think the reasons often come down to a lot of the same reasons that drive women to have plastic surgery.
Mm-hmm. Now, is it something that you would consider in the future?
Dr. Gaon, you want to take that one?
Sure, absolutely. Everybody wants to have an improved version of themselves. And so even if it's something simple like a Botox treatment to feather out some of the weathered lines or the wrinkles as we age, to something that's transformational like a body contouring surgery, whether it be non-invasive like cool sculpting or liposuction to get rid of those nasty love handles that don't go away no matter how much you go to the gym, work out. Things change as you grow older. Your metabolism changes, and it's not as easy as it was back in your 20s.
So body sculpting isn't just for women; it's
absolutely
for men
not.
too.
Yeah, absolutely not.
We have. I've treated my own brother. I've treated surgeons that we work with at the hospital next door. They'll come by between cases and get treated. Absolutely no. Our office. It's not. I don't think we're at the point where we're 50-50 male female. But you see, they've documented over and over. There's a big growing trend in men having more cosmetic procedures performed, both surgical and non-surgical.
Mm-hmm.
It's less of a stigma than it used to be.
Okay, so in society it's becoming more acceptable for men to go in now.
And we certainly also treat a lot of couples. They'll come in for couples surgery.
Do you do discounts?
Sure. From time to time, we'll do we do couples therapy, a plastic surgery version of it.
Oh, wow.
You know, well, some men, you know, in terms of looking at who comes in, sometimes it's men coming in by themselves for the first time, but frequently they're coming in with their wives. Now they have an excuse to come in. They see that their wife is well taken care of. They've already been in the office. They decide, well, while I'm here, I think I want to talk to you about something. So they come in a lot of different ways, but no, it's absolutely, 20 years ago, you wouldn't see very many men in the waiting room of a plastic surgeon's office. Now it's not uncommon to walk out and see a third of the patients in the waiting room are men.
Oh, wow. Well, thank you, Dr. West. Thank you, Dr. Gaon. They're from Finesse Plastic Surgery, and thank you for changing our view on men in plastic surgery. For more information about what they do, check out their website at finesseplasticsurgery.com.